What's the difference between DNI, do not intubate, and DNR, do not resuscitate in intensive care? That's a question we get quite frequently, but it's also a question that comes out of my last video where I talked about, was Grace Scara euthanized in intensive care? Ties in with my last video and blog post about Grace Scara, so go and check that out. My name is Patrik Hutzel from intensivecareoutline.com, where we help families of critically ill patients in intensive care to make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care. So today's topic is, what's the difference between DNI, do not intubate, and DNR, do not resuscitate in intensive care, or DNR? Now, this is a question we get all the time from families in ICU. And like I said, it ties in with my last topic and my last video. So you might hear the doctors or nurses say, your loved one is DNR or DNI, and you're left wondering what that even means. So let's break it down. Number one, DNR stands for do not resuscitate. What does that mean? It means that if your loved one's heart stops or they stop breathing, CPR or cardiopulmonary resuscitation will not be performed. No chest compressions, no defibrillation, no advanced cardiac life support. In short, they are letting your loved one die without attempting to revive them. Next, DNI stands for do not intubate. That means that if your loved one has trouble breathing, they will not be put on a ventilator, also known as a breathing machine, though a breathing tube, endotracheal tube, or tracheostomy. They might still get non-invasive support like oxygen or BiPAP, CPAP ventilation, but they will not be intubated and mechanically ventilated. Now, here's a real kicker. DNR and DNI are often lumped together in the ICU, but they're not the same thing. Your loved one can be DNR, but not DNI. Means they don't want CPR if the heart stops, but they do want ventilation if they're struggling to. DNI, but not DNR, meaning they don't want to be ventilated, but they do want CPR. Although this scenario doesn't make clinical sense, it's still sometimes documented that way. Why doesn't it make clinical sense? Because if someone can't breathe, they will go into cardiac arrest eventually and they need to be resuscitated. So that's why it doesn't make sense. DNR and DNI, which means no CPR and no ventilation. That's a combination as well. So here's why this matters. We've seen over and over again in ICU that DNR and DNI sometimes misused or miscommunicated, and families are left in the dark while decisions are made behind their backs. We've seen even DNRs and DNIs placed without consent or proper explanation, and that's simply wrong, and it's also illegal. So if your loved one has been labeled DNR or DNI, you need to ask who made that decision. When was it made? Was your loved one or you as the next of kin or the proxy decision maker involved in that decision? What does it mean in terms of treatment and care moving forward? Because here at intensivecareoutline.com, we believe that unless it's a clear, informed decision made by the patient or their medical power of attorney, which is you, it should not be enforced blindly by ICU teams because it can be life or death. Also, if it's life or death, you cannot go in those situations blindly. The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that is exactly what you are up against. So if you are in a situation where the ICU team is pushing a DNR or DNI, or if your loved one has one in place and you don't agree with it, reach out to us. We can help you reverse it. We help you advocate, challenge those orders, and keep your loved one alive if that's what you and your family want, because we've done it so many times. And you can verify that on our testimony section and on our intensivecareoutline.com podcast section, where we have done many client interviews. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecareoutline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.